First West Nile virus death in Colorado, 2025. What you need to know. Tragedy strikes. Colorado reports first West Nile virus death of 2025. The Colorado Department of Public Health and Environment is sounding the alarm, urging residents to take immediate action to protect themselves from the deadly West Nile virus. And for good reason. The state has just reported its first fatality from the virus this year, a resident of Boulder County. This devastating loss serves as a stark reminder of the serious nature of West Nile virus and the importance of personal prevention. As Dr. Ned Kalonge, Chief Medical Officer at CDPHE, poignantly stated, "This tragic loss underscores the serious nature of this virus and why personal prevention is so vital. But here's where it gets controversial. Are we doing enough to prevent these tragic losses?" According to the latest data, there have been 9 confirmed human cases of West Nile virus in 8 Colorado counties so far this year. And this is the part most people miss. The virus has also been detected in mosquitoes in 8 of the 16 counties that have tested mosquitoes this season, including Adams, Arapahoe, Boulder, Broomfield, Denver, Jefferson, Larimer, and Weld counties. So, how can you protect yourself and your loved ones from this potentially deadly virus? West Nile virus is most commonly spread to people by the bite of an infected mosquito. Symptoms typically appear 3 to 14 days after being bitten and may include fever, severe fatigue, headache, body aches, skin rash, and swollen lymph nodes. But here's the thing. Most people who are infected don't have symptoms, which makes it even more crucial to take preventative measures. People aged 60 years and older and those with certain medical conditions are at greater risk of serious illness. If you develop a fever with severe headaches or confusion, don't hesitate to talk with a healthcare provider. So what can you do to reduce your risk of getting infected? Here are some simple yet effective tips. Use insect repellent with DEET, picaridin, IR3535, oil of lemon eucalyptus, or paramenthendiol. Follow label instructions to ensure maximum protection. Limit your time outside at dawn and dusk, when mosquitoes that spread the virus are most active. Wear long sleeves, pants, and socks in areas with mosquito activity, and apply repellent to clothing for an extra layer of protection. Remove standing water from your yards and gutters weekly. Treat water that can't be drained with BTI larvicide to prevent mosquito breeding. Install or repair window and door screens to keep those pesky mosquitoes out. Stay informed about West Nile virus with weekly data updates and additional information, including historical trends, available on the CDPHE West Nile virus webpage. https://:/ animal-related diseases/West Nile virus/West Nile virus data. Now we want to hear from you. What do you think is the most effective way to prevent West Nile virus infections? Share your thoughts in the comments below. City of Fort Collins mosquito spray on July 24th and 27th. West Nile virus update. In a bold move to combat the rising threat of West Nile virus, the city of Fort Collins is set to launch a mosquito control operation in central areas. Here's the reality. Mosquito-borne diseases are a serious concern, and sometimes drastic measures are necessary to protect public health. The decision to spray for mosquitoes on July 24th and July 27th comes after a surge in West Nile virus-infected Culex mosquitoes was detected in the region. The spraying, which will take place on both Thursday and Sunday, is scheduled to start at dusk and will continue until approximately 2 a.m. the following morning, weather permitting. The targeted area includes the stretch from Overland Trail to Interstate 25, specifically between Mulberry Street and Drake Road. Residents can access a detailed map of the spray zone at www.fcgov.com/West Nile. For those curious about the extent of the operation, the same map will help visualize the affected areas. The city's contractor, Vector Disease Control International, VDCI, will use a permethrin-based product applied in a fine mist via fogging trucks. To minimize exposure to pesticides, residents are advised to stay indoors and keep doors and windows closed for about 30 to 60 minutes after spraying begins. It's also recommended to bring pets inside during this time. For those with organic gardens, ponds, or water features, covering them with a sheet or tarp can provide additional protection against pesticide drift. But here's a crucial point. Technology plays a key role in this operation. The fogging trucks are equipped with GPS tracking, allowing residents to follow the progress in real time by visiting www.fcgov.com/West Nile. This transparency is important for planning and safety. The decision to spray follows a recommendation from the Larimer County Department of Health and Environment, in line with the city's West Nile virus management policy. It's worth noting that the city consults with the Parks and Recreation Departments, Poudre School District, and Colorado State University to ensure that any outdoor events within the spray zone don't interfere with the operation. And this is the part most people miss. Collaboration is key in managing such public health initiatives. By working together, the city aims to minimize disruptions while ensuring the effectiveness of the mosquito control measures. Now the question remains, do you think such measures are necessary for public health, or do they pose potential risks to the environment? Let us know your thoughts in the comments below. First human death from West Nile virus recorded in Colorado in 2025. A sobering reality has struck Colorado. The state has experienced its first human fatality from West Nile virus in 2025. These events remind us just how dangerous this seemingly distant threat can be, and why personal responsibility matters more than ever. On Friday, health officials confirmed that an adult resident of Lafayette, Colorado became the state's first West Nile-related death of the year. Both the Colorado Department of Public Health and Environment, CDPHE, and Boulder County Public Health issued reports highlighting this incident, which follows a pattern of growing concern among experts. But here's where it gets even more alarming. As of now, 9 people across 8 Colorado counties have already contracted West Nile virus this year. Surveillance is also indicating that infected mosquitoes have been detected in half of the counties tested so far, specifically Adams, Arapahoe, Boulder, Broomfield, Denver, Jefferson, Larimer, and Weld counties. This pattern suggests we may be at the start of a significant uptick in cases. Do these figures hint at a new statewide challenge? Dr. Ned Kalange, CDPHE's chief medical officer, put it bluntly. This tragic loss underscores the serious nature of this virus and why personal prevention is so vital. He emphasized practical, evidence-based strategies in order to reducing risk, like regularly applying mosquito repellent, draining standing water where mosquitoes breed, wearing protective clothing, and making sure window and door screens are intact. For those wanting extra protection, it's wise to avoid being outdoors at dawn and dusk, peak times when mosquitoes are most active. Putting on long sleeves, pants, and socks, especially in mosquito-prone areas, may feel tedious, but it dramatically lowers your risk. And adding repellent even to your clothing can add another layer of defense. On the national stage, a similar cautionary tale is unfolding. In 2024 alone, the U.S. reported 1,971 cases of West Nile virus and 164 related deaths, according to the Centers for Disease Control and Prevention. Compare this to the mere 62 cases and 7 deaths back in 1999. The escalation is clear evidence that West Nile virus has become far more widespread and dangerous over time. In fact, over the past 25 years, the United States has seen almost 61,000 cases and more than 3,100 deaths attributed to this virus. And this is the part most people miss. Neighboring counties such as Pueblo and Weld also announced their first cases of the year just this week, driving home the message that the West Nile season in Colorado is truly underway. Weld County, for instance, had 15 investigated cases last year. With each new report, community concern grows more justified. Is enough being done to alert and protect the public? West Nile virus spreads primarily through the bite of mosquitoes that have themselves become infected after feeding on birds carrying the virus. After exposure, symptoms might develop anytime between 3 and 14 days. What's perplexing is that most infected individuals, even up to 80%, never feel sick at all. However, for those who do experience symptoms, early signs might look like the flu: fever, headaches, body aches, nausea, vomiting, and sometimes a rash. If you do start to feel unwell, medical professionals urge you to seek treatment immediately. But here's a controversial topic. With no cure or vaccine available for humans, should more resources be dedicated to vaccine research? Although severe complications are rare, with fewer than 1% of cases progressing to potentially fatal neuroinvasive disease, the elderly and those with pre-existing medical problems are at much greater risk. people older than 60, organ transplant recipients, or those with conditions such as diabetes, cancer, hypertension, kidney disease, or compromised immune systems are especially vulnerable. Weekly updates and further resources about trends and prevention can always be found on the CDPHE's West Nile virus data page. What's your take? Do you think Colorado and the U.S. are doing enough to prevent West Nile virus infections? Should there be more vigorous public education and mosquito control efforts? Or is this just part of natural disease cycles we must accept? Sound off in the comments. Your voice might just spark the next big step in community health awareness.